Hi, my name is Mohammed Aldeen. In this video, I would like to talk about a very vital and surgical procedure, stent placement. Stents are small, tube-like devices that are used to open up narrowed or blocked blood vessels. These blood vessels could be in various parts of the body, most commonly in the coronary arteries, which supply blood to the heart. When these arteries become blocked due to plaque buildup, it can restrict blood flow and increase the risk of heart disease, heart attacks, or even stroke. The procedure for inserting a stent is called angioplasty. A catheter is inserted into the artery, and a balloon is used to expand the blocked area. The stent, which is usually made of metal or a special mesh, is then placed to keep the artery open, allowing blood to flow more freely. In some cases, a stent may also be coated with medication to help prevent the artery from narrowing again in the future. To insert a stent, a long hollow tube called a catheter is inserted into the wrist or groin and guided to the narrowed artery using X-rays. A wire is fed through the catheter into the narrowed. Once the cardiologist is satisfied it's in the correct position, the balloon is inflated, widening the artery and expanding the stent to fit the artery wall. The catheter, balloon, and wire are removed, leaving the stent in place. The procedure takes between 30 to 60 minutes. The procedure is usually painless, as local anesthetic is used, and there are no nerve endings inside of the artery. Some people experience mild chest pain when the balloon is inflated. Stents are permanent. There is only a 2 to 3% risk of re-narrowing within 6 to 9 months, which can be treated with another stent. Taking prescribed medications and making lifestyle changes like stopping smoking, treating diabetes and high blood pressure, and lowering your cholesterol can reduce the risk of needing more stents. There is a small risk of complications associated with a stent, such as bruising at the insertion site, which usually clears within a couple of weeks. The risk of a major complication is less than 1 in 100. A rare risk is that a blood clot may be dislodged, causing a heart attack, but this is extremely rare. Another risk is the formation of a blood clot on the stent, which is about 1 in 50 in the first year, but this can be reduced with medication. Recovery after the procedure is usually quite fast, especially if the wrist was used for insertion. After a planned angioplasty, the heart generally recovers immediately. You may need to be careful with heavy lifting for a few days and take it easy for a couple of weeks. Aspirin is prescribed for life and clopidogrel for 3 to 12 months after the procedure to prevent blood clots. Allergic reactions to stents are very rare, and the body does not reject the stent because it isn't made of living tissue. Both NHS and private hospitals use drug-eluting stents now, artery, and a balloon with a squashed-down stent is inserted over the wire. They are made of metals such as stainless steel, platinum chromium, or cobalt chromium. Most stents are coated with a polymer and a drug to stop scar tissue growing in the gaps of the stent, which could cause re-narrowing. These types of stents are called drug-eluting stents and are used 95% of the time. Stents are tiny but vital devices that are used to hold open arteries that have become narrowed. They are commonly used in the treatment of heart attacks and angina. A stent is inserted during an angioplasty, a procedure that can be performed either as an emergency for a heart attack or as a planned treatment to widen a narrowed artery. When a blood vessel is narrowed due to a buildup of fatty plaque, blood flow can become restricted. If an artery is only stretched open with a balloon, there is a 30% chance that it will narrow again, but a stent reduces that risk to only 10 to 15%. If the stent is drug-eluting, the risk of re-narrowing is further reduced to around 2 to 3%. Stents are not only used in the coronary arteries of the heart, they are also sometimes used in the legs to treat peripheral arterial disease. They may also be used in the neck or in the renal arteries to treat narrowing. Stents are cylindrical and made of a very fine metal mesh. The most common stents are about 15 to 20 millimeters in length, but can vary from 8 to 48 millimeters and are 2 to 5 millimeters in diameter.